And your life.
All right, so Senate Health and Welfare will be back. And we're going to have a short conversation with folks regarding H401. And as we left H401 the other day, we heard concerns from rural Vermont about what's excluded for the little cottage industry. And so we want to hear from the Department of Health. Elizabeth Worsong, you're here. Thank you for being here. And Rural Health Vermont is also here. Carolyn Sherman Gordon. So the question that we asked, we had concerns, Elizabeth, regarding what's out. Does that mean that the folks who have been selling canned or bottled pickled asparagus and corn relish can't continue to do that under the language that's proposed by the Department of Health? And please introduce yourself for the record.
Sure.
And we should introduce ourselves really quickly because you haven't been in here before. So there's one start.
Senator Hart from Orange County.
Jim Lewis from Orleans County.
Jenny Lyons, Chittenden Southeast.
Martine LaRock Ulick, Chittenden Central. Ann Cummings, Washington District.
Thank you. Yeah, thank you for the invitation, Chair Lyons and Vice Chair Gulick, to come back and answer some questions. So I'm Elizabeth Worsing, the Senior Environmental Health Program Manager, and my role is overseeing the Food and Lodging Program at the Health Department. And we did hear the questions and concerns yesterday from rural Vermont, and we would like to address those. To your specific questions, those products would still be allowed under the $10,000 exemption that is still kept in the language of the bill that recognizes the landscape that has been present in Vermont. But we do have a suggestion for you if I could take a minute.
So you indicated that it would be allowed under the $10,000 limit. What happens when it's raised to $30,000?
Right. Yeah. I would be happy to provide. I think we have a recommendation for the committee to consider if you haven't. If you let me get to that for you. So, what we previously shared with you all that many other state laws largely limit the types of foods that can be produced for sale in home kitchens that are exempt from licensing. And that was based on the potential food safety risk of the products. So, for example, other states don't allow potentially hazardous foods that require time and temperature control for safety. And they also don't allow canning of acidified or low acid foods in cottage food operations. So most other states would require these producers to be in licensed kitchens and prohibit those from being made in a home exempt kitchen. Also, many state laws we reviewed also limit sales of exempt cottage food directly to consumers and within that state. And this may be partly due to the federal food safety regulations that include requirements specific to acidified food and low acid canned food producers, which include real specific training requirements and requirements to file and register a scheduled process with the Food and Drug Administration for food facilities operating in interstate commerce. So to better align Vermont law with similar laws, the department provided some suggested language. I think to your specific question of whether producers of pickled and fermented foods would be included in the increased exemption threshold proposed for these cottage food operators, our recommendation for the committee to consider would be including some additional language that would include certain home canned pickles, vegetables, or fruits while balancing the food safety risk. So the language would be to add home canned pickles, vegetables, or fruits that have a pH value of 4.6 or lower, or a water activity value of 0.85 or less to the definition of cottage food. So that could include those products you're interested in under the $30,000 exemption. And then also we would ask to require these products be made using validated recipes that are available for free from the National Center for Home Food Preservation, or if producers want to use other product recipes or their own recipe, those would be required to be reviewed by a process authority for safety. And those requirements would be consistent with what is required by other states that allow pickles and fermented products to be produced by exempt home operators. A process authority review is a pretty common food safety requirement, and the department already has authority to request this documentation be provided. And a process review would be completed by a process authority, and it's an evaluation of how the product is made, including ingredients and the steps of preparation and packaging. The process authority is a person who has expert knowledge in thermal processing requirements for both low acid foods and also knowledge in acidification and processing of acidified foods. So we do have process authorities in our region, and there's lists of existing process authority resources. Currently, a product could be evaluated by a process authority in our region for between $150 and $190. And so for producers of innovative products, having a process review that confirms food safety hazards will be mitigated can also increase consumer and retailer confidence in these products made in a cottage food operation. And sometimes it's a requirement for selling in retail stores. So this recommendation, and we can provide some recommended language, would raise the exemption threshold for home canned pickles, vegetables, and fruits while using existing and widely accepted food safety management tools to reduce public health. So I can stop there and see what questions you might have.
Thank you. This is really very helpful. I hope it's helpful to rural Vermont. I see you shaking your head, Carolyn, and I thought, why don't we just, are there questions for Elizabeth at this point? Go ahead.
Are you referring to new language in addition to language that we already have drafted?
Yes. Yes.
So
Yeah.
an additional language that Jessica Schifano, our policy director who's with you today, she has it ready for you, if that would be of interest.
All right.
Yeah, no, thank you for that. I think it would be helpful for us to see it, and then we can have a discussion on it. Go ahead.
Yeah, I'm happy to see it, but the first time that the department testified on this bill, which I think was over Zoom the first time, I asked for data and stuff to back up the claims the department was making about food safety concerns. And I still have not heard any credible reason for the amendments that are proposed by the department. When you can your pickles, you boil them, you water bath can them, they're boiled. So I don't know if Listeria is able to withstand.
No, Clostridium you might get from the soil, but
Yeah,
there are different reasons. Well,
you boil them for like an hour.
yeah, so we'll
Get watch.
I make them. Elizabeth, do you want to respond
Sure.
to the question?
Yeah, thanks for the question, Senator. So the key with some of these canned products to make them safe and shelf stable is actually managing the pH and the water activity. So that's why certain things like pickles can be canned because the acidity is brought down below 4.6 and the water activity is less enough that there's not additional moisture that can be an environment for bacteria to grow. Canning is an anaerobic environment, right? So this is really important in order for things like botulism to be prevented. So that's why the specific language we're providing, not everything can be safely canned. So for example, pesto is a good example of something that does not meet the pH requirements and water activity for canning. So that's why pesto is often sold frozen. You might see that as a product. So these requirements are consistent with other states and food science. And I'd be happy actually to address your foodborne illness question because I know that did come up yesterday. So just more broadly, the department has a surveillance system for reportable foodborne illness. And these systems detect cases of illness where individuals have sought medical care and been tested for an enteric illness, and the pathogen has been confirmed. So we know these cases represent just the tip of the iceberg of foodborne illness in Vermont, and there are estimated to be many more cases of illness that do not seek out the healthcare provider. So you can think of times when you've had gastrointestinal illness and maybe wrote it out and did not seek out care. So, however, more severe illness and outcomes are often seen in children, adults 65 or older, pregnant people, and people with weakened immune systems. So, in Vermont, the most common foodborne and diarrheal infections are Campylobacter, Cryptosporidium, E. coli, norovirus, and Salmonella. And in 2024, the preliminary data of reportable illness included 474 cases across the state. So that included over 200 cases of Campylobacter, 110 cases of Salmonellosis, 65 cases of Shiga toxin producing E. coli or STEC, and 5 cases of Listeria, which we mentioned before. So cases can often appear sporadic and are interviewed to identify the possible exposure sources. And people often report eating food from farmers markets or neighbors and friends and colleagues. But unless it's an outbreak, it's difficult to pinpoint the cause of a single case. So outbreaks are identified when multiple cases match by whole genome sequencing, and that's a process performed in our public health lab, which indicates a common exposure source, and that allows the EPI investigation to evaluate exposures among multiple cases to determine those commonalities. And so, as mentioned in the House committee, the department is regularly investigating cases and clusters behind the scenes. So this has included outbreaks associated with unregulated and unlicensed operators. I just want to clarify that because that was misstated yesterday. Unlicensed operators and events such as a Salmonella outbreak with 16 cases linked to a community event, a Salmonella outbreak with 3 cases linked to a homemade dinner, a Campylobacter outbreak with 10 cases linked to an agritourism destination served meal, and a Cyclospora outbreak with 9 cases linked to a community event. So, in summary, we have foodborne illness in Vermont, and situations are routinely investigated behind the scenes, but foodborne illness is widely underreported, and we know that the actual number of cases are higher than what is captured in the reportable disease system. So for a foodborne illness event or a food product recall or pathogen found in a product, that can be devastating to a food business. And there can be financial and legal implications and consumer confidence concerns that are challenging to recover from. We also reminded the committee that foodborne illness is preventable, and our ultimate goal and the goal of many businesses is to prevent these food safety issues from happening in the first place. Thanks.
Go ahead, Senator Douglas.
Thank you. How many of those cases resulted in death or severe hospitalization, ICU? And as you said, you can't attribute them to any particular cause. It's only kind of anecdotal. Somebody could say, oh yeah, I ate an asparagus yesterday from the farmer's market, but they forgot to talk about the sketchy taco they had at the gas station. So, you can't, or the sushi from the gas station, there you go. From the vending machine, actually, yeah. So it's impossible to pinpoint where exactly we got it from, and so I'm just interested in how severe the cases are. And as you said, a lot of people just write those things.
Senator, what I'm going to ask
Yeah,
is, can you please, Elizabeth, send us some data about how your epidemiological work is done, so that to clarify that, to provide an answer to this question. I think we're going off in a direction here, which is important, but I think we want to answer questions specifically about the bill in front of us. And I want to get to rural Vermont because I saw some agreement between what Elizabeth was saying, Department of Health is saying, and what rural Vermont had questions about, we can come back to this, there's no question, we can come back to it. And we do have other questions that we asked, the other day about this. But, yeah, I don't want to get into debate about how the Department of Health does its work. Okay, but we want to hear how they do their work, so we can do that. So, because it is important, if you have a little farm stand and you sell your stuff and 20 people who came by get sick, you don't want that to be the way you are marketed.
Mhm.
Okay, so that's the role that we're giving Department of Health.
We have the language.
In this committee, our job is to protect public health. Other committees' job, it is to promote economic development and farm products. We're the balance that looks at, and one case of food poisoning is too many. I mean, and you can get into a lot of arguments. The Mexicans drink the water in Mexico. Americans get really sick. So do we not treat our water for bacteria? It's a lot, some of it is exposure.
So I want rural Vermont to have a time here because we're going to end pretty soon.
And we do have the language. It was emailed.
We have language. We will look at the language and then we'll bring folks back to ask all of these really critical questions. So go ahead, Carol.
Thank you all so much for having me back. For the record, it's Caroline Sherman Gordon, Legislative Director of Rural Vermont again. And yeah, I really appreciate Elizabeth bringing forward on behalf of the Department of Health further language and showing the goodwill to make this work for cottage food producers and clearly not intending a policy that would like uplift sugary and candy products above other preserved foods, and I think the what I hear about the proposal without having seen it is that it would be common sense for us. I mean, many of our folks do use these widely available recipes and such, and I think this would be language we could live with, and would be a step in the right direction. I think what I would want to add from where our conversation went yesterday is that Senator Douglas had made a really good point in that this new language, that's the amendment from the Department of Health, also in its definition of cottage food operators, changes the definition of food manufacturers to a degree where now it's kind of also going to be prescribed that it has to take place in the home kitchen like that. That would be worth clarifying for us as well. I'm not sure if that was always like that, but I just want to say as well.
Can I interrupt? Are you asking the question, if you have a kitchen in one building, your home, and then you have another place that you have built and you have your own little home kitchen, are you asking, can it be in that separate building and kitchen? Or
I would go a step further. I think if the interest of the committee, and of course it is the interest of the state, to really do the best for those emerging food manufacturing businesses for which the income threshold of operating under exemption is really an onboarding business development opportunity, correct? That what our shared interest, I believe, is that they do that from the start and in the best of their abilities. And if we want to invite folks into that space who might not have a setup at home where they can produce food in a safe way, there's also this whole movement of, the whole state is trying to really increase local self-reliance and enhance the food system. There's food hubs, and some of these food hubs also have really well established commercial kitchens in them. And any food manufacturer under exemption, they have to put on their label now a warning also that that makes transparent to the consumer that product had not been inspected by the Department of Health or anything thereof. And I'm just thinking some producers might be better served not to be pushed into their maybe rancid home kitchens for their business development. But if there's in the community, let's say a commercial kitchen available, or even like a community center kitchen available, that's better than what they have at home, or also even incentivize communities to pool resources to provide such space.
So Carolyn, Carolyn,
Yeah.
we got it. So it's a question for the Department of Health, and I do know that we have a food production facility in Franklin County where folks can go and make their home products. But so Elizabeth, can you comment on what we're hearing from rural Vermont?
Yeah, thank you for the question, Carolyn. We agree. So a lot of producers might start off in their home on a very small scale, and the home kitchen provides, some of the equipment that we would expect operators are using, right? So the hand washing sink, the dishwashing sink, and surfaces that would provide support for safe food production. Once people expand, a lot of times you're right, they do seek out those food hubs or commercial kitchens or a larger space. And those, I would say, are very easily licensable for that operator by the department, right? They meet a lot of the commercial kitchen standards. And that also, holding a license really opens up the door to selling those products more widely, some of the buyer specifications that folks might need to introduce products into the marketplace more easily. So that is a model that currently exists and is working well and is easy for folks to obtain a license in those spaces. And that's what we would prefer, right? Operating in a commercial kitchen that is separate from the domestic home kitchen. The thought of cottage food nationally is very small producers in the domestic home kitchen. So that is typically how that's been outlined. Thanks.
All right, Senator Julick has a question, and then I'm gonna make a comment. Okay.
Thank you. Thank you, Elizabeth, for your language that you sent, or Jessica sent it. Thank you.
Jessica sent it.
Question about the measuring the home canned pickles, vegetables, or fruits having an equilibrium pH value of 4.6 or lower, or a water activity value of 0.5 or less. Is that easily measurable by folks who are, canning or doing cottage food production?
Yeah, thanks for the question. So what we offered is folks could use approved recipes that would be validated to reach those pH or water activity, or can have a process authority review, which would also confirm those levels. For an operator, what a lot of businesses might do, and some home operators may have this, is you can measure with a pH meter. You could verify the pH in your home as well. But there are a couple different avenues for confirming that safe pH level.
Okay, so as long as they're either using a recipe that's approved, or reviewed by food processing authority, then they're okay. They don't actually have to do the measuring. Okay,
That's all, Chris.
got it.
Your vinegar has an acidity level.
Right. Yeah. All right. Thank you.
Okay, so here's what I suggest. I think there are, I think we heard the Senator Douglas has a question about how we measure whatever protection is offered by the suggestions from the Department of Health. We want to maybe get some data on that and how your analysis is done. But I'm also hearing that there's some agreement here between rural Vermont and what the Department of Health has presented to ensure public health safety. And what we'll do is we'll ask our ledge council to integrate the language that you brought to us, and then we'll go through it for markup purposes and try to get the bill moving. We can't do that today, obviously, but we'd like to have this little bill move along. It makes a lot of sense to increase the threshold to $30,000, but at the same time, we can clean up some of the other language that has been missing in statute. You have a question? I'm gonna take a quick question, but I do not want to comment at this time, Carolyn. So go ahead.
Yeah, I guess the follow-up question to the location discussion would be if the Department of Health would basically be opposed for producers under the exemption to use commercial kitchens for the production of cottage food, since that proposed language that defines cottage food operators would be preventing that. And so therefore, I think like lower income potential producers that might not have a home setup that allows like for two sinks and all that would be excluded from the market if this language were to prevail.
Okay, so that's a question. We're past time for adjourning. And Department of Health, you can bring us that information when we get back together sometime next week. And we'll look at language and we'll try to clarify the language appropriately. So thank you all. This has been really a great day. And we are calling ourselves